Welcome to the Dr. Diane Show, where we explore revolutionary expansion of mind, body, and soul with me, Dr. Diane Hayden. With over 20 years of expertise as a mindset warrior, perspective shifter, and unshakable optimist, I am dedicated to helping you reach your wildest dreams in business, health, performance, and relationships. Learn about the power of thought and how it shapes your life to take risks, change careers, find love, go on adventures, and live passionately with me, Dr. Diane. Get ready for revolutionary ways of thinking, being, and creating an amazing life. The Dr. Diane Show starts now. Hello, everyone. I am Dr. Diane Hayden, and you are listening to the Dr. Diane Show on Transformation Talk Radio. Stay with us for the next hour, where we will explore revolutionary expansion of mind, body, and soul. Each time on the Dr. Diane Show, we have experts from around the country discussing cutting-edge topics on longevity medicine, natural health, mindset, and soul purpose to help you shift your perspective and become a mindset warrior like me. I'm excited today to have Dr. Myriah Hinchey. She practices integrative naturopathic medicine for the whole family and additionally specializes in the reversal and prevention of chronic Lyme disease. Her treatment practices rely heavily on the principles of functional medicine and therapeutic lifestyle change. Dr. Hinchey identifies the underlying physiological biochemical cause of the patient's symptoms and then teaches them how to correct it by making simple but effective changes to their lifestyle, often utilizing a combination of nutrition, supplementation, exercise, stress management, acupuncture, and massage therapy. In addition to naturally treating patients with complex illness stemming from underlying tick-borne disease at Tau Vitality in Connecticut, Dr. Myriah Hinchey created Lyme Core Botanicals to provide quality, clean, and effective herbal formulas for Lyme disease and other tick-borne infections. She is highly active in source testing and overseeing production of the herbal formulas she uses to treat her patients. Dr. Hinchey also founded Lyme Bites, which is a multimedia company dedicated to educating patients and other practitioners about Lyme disease and tick-borne illness, and focuses on bringing patients, practitioners, and resources together for healing Lyme disease. The next Lyme Bites conference is being held on November 10th and 11th of 2023 at the Hilton Mystic in Mystic, Connecticut. And if anyone is interested in learning more, you can go to tauvitality.com for those interested in becoming a patient, lymecore.com for those interested in herbal remedies, and lymebites.com for those interested in education and the conference. So welcome, Dr. Myriah Hinchey. How are you today?
I'm great, Diane. Thank you for having me. It's always such a pleasure to be here with you.
Of course. I love talking to you because we get into all the nitty gritty about Lyme disease for sure. And we've got some exciting stuff to talk about today to all of our listeners. But I wanted to, we've done these shows before, and I know people have probably seen our interviews before. But for those of you who are meeting you for the first time, I always like to have you talk a little bit about why you are so passionate about treating Lyme, so people, our listeners, can really get to know you a little bit better.
Sure. So I would say, probably the number one reason is that as a naturopathic doctor, we are trained to identify the underlying cause. And so tick-borne disease in general is often a overlooked and misdiagnosed underlying cause of a lot of patients' symptoms. And really it goes from musculoskeletal to neurological to psychiatric to GI and even urinary, cardiac, etc. So there's just, Lyme infects every single cell in the body. And so you're going to have issues in all of the different systems of the body. So it's really hard, to be a functional medicine doctor and be a doctor that's always trying to get to the root cause and not at least ruling out tick-borne disease as one of those underlying causes.
Yeah, definitely, for sure. And like you said, it's hard to diagnose. I think it's hard for people to really know whether they have Lyme disease or not. Are there any initial signs or symptoms of Lyme that you can tell us about that people need to be aware of?
So with acute Lyme disease, oftentimes patients will have a stiff neck or a headache, or they might have a fever or malaise, or just feel like they're coming down with the flu. Less than roughly 40% of patients actually have that classic erythema migrans or bullseye rash. And I think it's roughly less than the same percent actually remember seeing a tick or having a tick bite. So we can't really rely on those telltale symptoms that we're all taught as physicians to recognize. And if you don't catch an acute case, which sometimes can happen because it's a lot of times just flu-like symptoms, really as the disease goes on and progresses, it can present in a multitude of different symptoms, from heart palpitations and, hot flashes, night sweats, anxiety, obviously the muscle pain, joint pain, headaches, things like that. But there's also a lot of cognitive decline. I see a lot of kids who end up coming in with symptoms of PANS, or pandas after, having a Lyme infection, because it actually causes an autoimmune type reaction, to the brain, and can cause a lot of like OCD and weird behaviors or acute onset of tics and things like that. So, it really depends on the person. And I always say, Lyme is going to prey on the patient's weaknesses. And so we all have certain genetic SNPs, right? And genetic predispositions, but then we also have injuries, right? We have these structural weaknesses in our body too. And so Lyme presents differently in different people because of our past makeup with our body.
Yeah, and like a lot of the symptoms that you just talked about, things like heart palpitations, night sweats, all like things like that. I'm listening to that and I'm thinking, oh yeah, that's menopause.
Yeah.
A lot of women might just chalk that up to that and not realize that they have a Lyme infection.
Yep. I have a lot of women who come in who want help with menopausal symptoms. I've had women come in their late 60s and 70s who never had menopausal symptoms, who are now being told, oh, they're just having, drenching night sweats because of their hormones. And then you
Yeah,
dig deeper and you see it's in a multitude of systems in the body. And it's like, well, yeah, that doesn't make sense.
right. Exactly.
Or kids that come in with ADHD or OCD or other symptoms like that, right? And it's like, no, that's not what's going on.
Right, right, exactly. So you mentioned acute Lyme, and then also I'm guessing if it's not caught, then it becomes chronic Lyme, correct?
Right.
Okay, so tell us like how and why does that happen?
So I think really the basis of it is that when the infection first enters the body, it causes an inflammatory cytokine cascade. And so the particular cytokines that the infection ignites cause a shift in the immune system. And so when I'm explaining this to a patient, I like to use this analogy. So our immune system should be able to act like a sniper, where it can see its target, it puts the little red dot on it, it knows what ammo to use, and it eliminates it perfectly. And it does it without causing damage to any of the surrounding, cells or terrain of the body. And so when the immune system is functioning correctly, that's how it would happen. But once Lyme gets in there, it confuses the immune system, and the immune system starts to act like the plane flying overhead and dropping bombs, right? So it knows its target's down there, and chances are it's going to hit the target, but it blows up everything else in the crossfire. And so it's like the body knows that something's there that's not supposed to be, but it can't really see exactly where it is or how to kill it. And so that causes this further inflammatory cytokine cascade. And it's like this vicious cycle that doesn't turn off. And then there's another molecule called galactin-3, which is it's a pro-inflammatory chemical that basically helps the immune system in an acute infection or injury to bring in the immune cells to either heal the injury or kill the infection. And then it quiets down and everything goes back to normal. But when Lyme is in the body and it hasn't been eradicated, that galactin-3 stays elevated, and it's like the fire alarm that never turns off. So it keeps recruiting all of these immune cells and inflammatory cells to come in. And chronically, that leads to a lot of issues. And so this galactin-3 molecule also helps to build the biofilms that these organisms can actually hide in and evade the immune system. It suppresses an immune cell called a natural killer cell. It promotes inflammation in the tight junctions in the gut and increases gut permeability, which leads to translocation of undigested foods, as well as leaking toxins and things back into the systemic circulation, which increases our toxicity and therefore inflammation and oxidative stress, and leads to a whole host of other issues downstream that I see in a lot of my Lyme patients, like food intolerances or systemic toxicity or inability to properly digest, and then micronutrient deficiencies. And you end up with this whole huge ball of wax where every system in the body is now being affected.
Wow. I mean, it's really crazy how all encompassing it is. And as you're talking about some of these things, like, it sounds, we're not going to go down this road on this topic, but I just wanted to kind of like make this link. It's almost sounds like you're talking about COVID when you're talking about just the cascade and that whole thing.
So it's interesting because tick-borne disease and the spike protein from COVID ignites the exact same pro-inflammatory cytokine cascade, as well as elevated galactin-3 levels. So they're almost, once you hit that inflammatory cytokine level, they're almost identical in the presentation and what happens to the body with the pathophysiology.
Wow. Yeah. Yeah. Really, really fascinating and scary, honestly, like to listen to all these things that happen. So you really want to catch this when it's in the acute phase, because once it gets into a chronic situation, just all of the things that you mentioned, I would imagine it's even harder to figure it out and then figure out a treatment plan for these different patients, for sure.
Right. So prevention is for sure key with us.
Yep.
And if you can't, stay out of the areas where there's a lot of ticks, which, I mean, it's really, really hard, especially where I live. You can't even walk across your lawn because there's birds and chipmunks and squirrels and, everything that carry these teeny tiny little nymph ticks, but at least doing tick checks, especially with your kids.
Exactly. So we're going to get into a lot more about this. We're going to take a short break. You're listening to the Dr. Diane Show with me, Dr. Diane Hayden. When we come back, we'll explore more with Dr. Myriah Hinchey. Stay tuned. We'll be right back. We're back on the Dr. Diane Show with me, Dr. Diane Hayden. But before we continue, I want to make sure everyone knows how to contact me. You can find me at www.drdianehayden.com or either of my two publications, www.naturalnutmeg.com and www.essentialnaples.com. And you can learn more about Dr. Hinchey at www.taovitality.com. That's spelled TAOVITALITY.com if you're interested in becoming a patient. www.lymecore.com. That's LYMECORE.com for those interested in herbals, and lymebytes.com. That's LYMEBYTES.com if you're interested in learning more education or attending Dr. Hinchey's conference. So before we broke, we were talking about galactin-3, how it plays a role in chronic inflammation and the whole inflammatory cytokine cascade. So what do we do? Like, so let's say you figured that out as a clinician. What's the next step?
So specifically dealing with the inflammatory cytokine cascade and galactin-3. So for elevated galactin-3, I would say the best thing to do for that is to use this specialized form of modified citrus pectin. I can reference brands and things.
Absolutely.
Yep. During this. Yeah. Yep. So it's Pectisol C, and that is the only form of modified citrus pectin that has actually been studied. and proven to decrease interleukin 6, interleukin 1 beta, galactin 3 levels. Obviously, it reduces or actually helps to break down the biofilms. And sometimes we can have heavy metals that are incorporated into these biofilms. It helps to bind onto those heavy metals. It helps to bind the LPS or endotoxins that are released by the dying bacteria and can lead to that Herxheimer reaction where you feel a lot worse. It helps to actually decrease nuclear factor kappa beta, like in the tight junction area of the gut, to help to kind of seal back up the tight junctions. I feel like I am forgetting something, possibly. Oh, and it helps to decrease fibrosis, especially in tissues that are supposed to be made by collagen. And it helps to actually promote healthy collagen formation. And then it also has a dose-dependent increase in natural killer cells. So it really counteracts, obviously, all of the things that galactin 3 does in the body in a chronic infection. As far as the inflammatory cytokines specifically, Japanese knotweed, Chinese skullcap, and ashwagandha, those 3 herbs together will actually inhibit nuclear factor kappa beta, interleukin 6, interleukin 1 beta, tumor necrosis factor alpha, as well as the MAPKs. And like those are the major cytokines that are pro-inflammatory and really shift the immune system out of balance. And those 3 herbs, and out of those 3 specifically, ashwagandha really helps to kind of give the immune system back its balance. So just literally with this pectosol C, Japanese knotweed, Chinese skullcap, and ashwagandha, we can really start to decrease inflammation like from its source and help to make the body inhospitable to these infections.
So how I'm assuming that you're finding all this out, like what's going on with the immune system through blood tests, or what kind of testing are you doing? So people, to understand what exactly is happening in the body.
Right. So, I mean, there are various tests where you can actually look at the different cytokines themselves. I don't do a ton of that because it's typically out of pocket. Galactin 3 you can measure through Quest or LabCorp. It's typically covered by insurance if you're using the right ICD-10 codes. So, I can look at those. I do often look at galactin 3 levels, but really you can tell by the symptoms, right? So most of the symptoms that are caused by these infections are caused by the inflammation. So pain is from the inflammation, right? Most of the dysfunction, a lot of the cognitive dysfunction is from inflammation in the brain. This is just popping to my head, so I'll use it as an example. Patients that feel like they are having chronic UTIs, but yet they go to the doctor and they're told, there's nothing there. They don't have a UTI, nothing cultures out. That irritable bladder symptom that a lot of Lyme patients have, that's because of inflammation in the bladder, right? So where the inflammation is what your certain symptom is going to present as.
And basically, so how this all happens is essentially, the body is trying to fight this infection, and the inflammatory cytokine cascade is when, you've explained that it's really your immune system is just out of control, like just trying to attack everything basically. And it leads to this cascade of events that weakens the body. And so is that how all these other opportunistic infections can emerge? And now basically you've created this environment that actually helps these infections thrive, right?
Right. So you'll see a lot of reactivated Epstein-Barr. And if it's not like reactivated, you'll see the patient's titers significantly abnormally elevated, not just suggesting a past infection. I'll also opportunistic bacteria in the gut will tend to, grow out of balance. Candida or other fungal family microbes will start to grow out of balance. And a lot of times, if it's a patient who's been on a lot of antibiotics, so a patient that already knows that they have Lyme, they have chronic Lyme, and they've been on and off antibiotics for years, those patients a lot of times are going to come in with candida overgrowth, for example. And a lot of times they not only will have overgrowth of some of these opportunistic bacteria, especially in the gut, but they will be severely deficient in a lot of the normal, healthy flora, that we think of when we say the word probiotic. And a lot of that flora is really responsible for our bodies being able to be anti-inflammatory and for our gut to function properly and for our immune system to function properly. So, a lot of the treatment, it's a double-edged sword, right? So if you're using heavy-duty pharmaceutical antibiotics that can kill these organisms, but they're also killing your healthy flora in your gut and allowing for this opportunistic overgrowth of bacteria, you're setting yourself up in a way where your immune system is going to sustain further damage and further dysfunction. And so, what I've learned and what I've been taught is that in the end, there's really no amount or combination of antibiotics that take any infection in the body to zero, right? So antibiotics help to shrink the bacterial load, right? And so once that load has been shrunk to the level that that person's immune system can then finish wiping out of the body, that's exactly what happens. But when you have an infection that breaks the immune system, and then you're further breaking down the microbiome using long-term, and I'm not saying anything about short-term courses of antibiotics. I am not against antibiotics, so I don't want anyone listening to this to misunderstand me. But I'm saying we're at a conundrum, because how do you heal the immune system, which is largely dependent on the integrity of the gut and the microbiome, when we're using agents to actively break it down? And so that's where I say we have to have a paradigm shift, and we really have to focus on healing the patient and rebuilding their immune system, fixing the terrain by decreasing inflammation, healing the gut, detoxing the patient, obviously balancing and fixing the immune system in the end, so that while you're shrinking that infectious load, in the end, you're rebuilding the immune system so that it can either wipe it out, if that's possible, or at least hold it into remission.
Yeah, definitely. I mean, it's a lot to, have to deal with diagnosing, figuring out what the treatment's going to be, and then through the whole treatment plan. I mean, how long do you typically work with a patient? Is it completely vary, or do you find that there's like you're working with someone for 6 months to a year, or maybe even longer?
So I would say it depends on the person. It depends on how compliant they are. It depends on how long they've been infected for. And it depends what previous course of treatments, they've done. And then it also really, I would say, largely depends on somewhat their genetics and their SNPs and what's going on inside of their body. So there's a lot of variables. I would say on average, and this is a very, very wide average, I would say 1 to 3 years.
Mm-hmm.
And,
Yeah.
that depends. If someone's been infected for a year, then, they're probably more at about a year if they're compliant. If they've been infected for, let's say 2 to 3 years, then I would say between 1 and 2 years. If they've been infected for 3 to 5 years, then it's more like 3. Like it just really depends. And it depends again on their compliance.
Yeah. And that's a big thing, I think, is how compliant is the patient. I talk to holistic practitioners all the time, and that might be their number one struggle
Yeah.
is
Well,
getting
and we
people.
haven't even gotten into the whole like lifestyle modification piece of this, right? Because if you're
Yep.
actively eating things that are causing inflammation and distracting your immune system or overreacting it, right? And all of that, then you're working against it. There's not really any herbal medicine or prescription medicine that you're going to be able to take to offset what you're putting into your body day after day after day after day, especially if it's something that's acting like poison inside of you.
Yeah, totally. It's like my analogy is, you can't exercise off fast food or bad nutrition
Right.
enough. It's kind of like the same thing. And I want to get into all of the herbal remedies that we're going to talk about and your protocols. So we're going to take a quick break. You're listening to the Dr. Diane Show with me, Dr. Diane Hayden. When we come back, we'll be talking more about natural treatment for Lyme disease with Dr. Myriah Hinchey. Stay tuned. We'll be right back. We're back on the Dr. Diane Show with me, Dr. Diane Hayden. I'm talking today with Dr. Myriah Hinchey. She's a naturopathic physician who specializes in the treatment of Lyme disease. You can learn more about her at www.taovitality.com. That's TAOVITALITY.com. And if you're interested in her upcoming conference, you can learn more at lymebites.com. That's www.lymebytes.com for information on her conference and education. So we've been talking about basically, just how to understand the symptoms and what happens in the body, all of the inflammation, the cytokine cascade. I want to get into now how you specifically work with your patients. So I know you have something called a 10B approach, which are your principles to healing tick-borne disease. So let's get into that and let's start talking about, what are the plans that you put people on?
Okay. So I'll start by going over the 10 core principles, or the 10 Bs. So number one is background, right? So we have to do the background check. We have to look at that individual patient, and we really need to figure out, like, what are all the pieces of their puzzle? So what micronutrients are they deficient in? What food sensitivities do they have? What hormone imbalances, just basically like head to toe, everything in the body, what is going on in that particular patient, like with their physiology. And then we move on to Band-Aids. And I don't like Band-Aids. And I tell people all the time, I don't do Band-Aid medicine, but a lot of these patients are suffering so severely and their quality of life is just terrible. And so we might have to do some temporary Band-Aid medicine while, treating the symptoms is what I mean by that, while we're doing our sort of like investigation to figure out what the underlying causes are. And so some of you might just go, well, wait a minute, their tick-borne disease is the underlying cause. What are you talking about? And it's like, I will argue that the tick-borne diseases have made further underlying causes, again, depending on that patient's weaknesses, that make the patient hospitable to these infections and help these infections thrive. So again, sometimes we need to try to get them out of pain, or sometimes they need an anti-anxiety medicine or something to be able to help them with the quality of life while we're doing that investigative work. So then the third B is to block inflammation. And so this, we have to look at three parts. So obviously we need to block the galactin-3, and we do that using the Pectisol C, or Lymecore's product is called G3M, galactin-3 modulator. We need to inhibit the inflammatory cytokine cascade. Again, Japanese knotweed and Chinese skullcap, in my opinion, are the two best herbs for doing that. And then we need to inhibit the enzymes that break down the extracellular matrix and collagen to feed the infection. And again, Japanese knotweed, Chinese skullcap, and ashwagandha are the three herbs that are the best at doing that. The fourth B is to balance the immune system. So again, ashwagandha. And I love it when you start hearing these redundancies, because instead of having to put someone on 10 different things to do the 10 Bs, you can already see that I'm saying a lot of these same herbal medicines over and over again. But anyway, so for balancing the immune system, my favorite is ashwagandha. I would say second runner-up is red sage. Then we need to build back up the gut lining. So we have to work on those tight junctions. My favorite for that is using Pactisol C, but also Japanese knotweed, and SBIs actually are really good as well. So the sixth B is to bolster the detoxification pathways. And so, you know, everyone is big on drainage, and I'm not knocking that at all. But I feel like we have to focus on the routes of elimination, so the routes out of the body, before we can start mobilizing toxins from cells, right? So we have to make sure the person is having bowel movements every single day. We have to make sure that their urine output is adequate, that they are sweating, that they're doing deep breathing, that they're using all of their routes of elimination, so that when we start mobilizing toxins, you can actually get them out of the body. And it's super important to make sure that you're coordinating phase 1 and phase 2 and phase 3 of the liver's detoxification process, so that you don't have a buildup of those toxic intermediates that are actually more damaging than the original toxin that you started with. Making sure that like methylation, if the person has methylation SNPs, you know, that you are giving nutrients needed for that. And obviously making sure that the gut is as healthy as you can get it, because if you are leaking toxins back in through the tight junctions in your gut, you cannot detoxify. 7 is bind. So we want to bind the toxins. We want to bind endotoxins, mycotoxins, other biotoxins, heavy metals. Again, I love Pactisol C for this. SBIs work really well. Chlorella, you know, there's a lot more binders that are a lot stronger. I tend to like to stay with the weak binders, because the weak binders aren't going to bind up your nutrients and other things as well. And you do really need to be careful with this, especially if you're looking at a long term. So I was just speaking with a colleague about this the other day, and we were talking about, you know, studies showing the affinity, for example, with charcoal and its ability to bind certain infections in the gut. And it's like, well, yeah, that's okay if you're going to do that for a week or even maybe a couple weeks if you're taking it away from all of your other stuff. But if we're talking about putting someone on long-term binders, I really don't think that it's a good idea to be using something as strong and powerful that's really just going to bind everything up like activated charcoal. So I will tend to go with the weak binders like Pactisol C, chlorella, etc., because they still do bind. They just don't bind excessively. The 8th B is breaking down the biofilms. Again, Pactisol C is really good at doing this, but also we have proteolytic enzymes like serrapeptidase, nattokinase that we can use. And there's a whole host of herbs that actually help to break down the biofilms as well that are very helpful. The 10th B is to buffer the effects of stress and all of this on the autonomic nervous system, because there's a lot of dysautonomia that comes out of this infection. And despite all of those symptoms, just being chronically stuck in fight or flight, where you're just pumping out the cortisol suppresses the immune system. And again, like, what is the goal in the end, right? To fix the immune system so your immune system can get this out of your body. So we really do have to take seriously the stress that this causes, both physical, mental, emotional stress. And we have to get the patients into a better mindset and doing things like, you know, deep breathing exercises, stimulating the vagus nerve, trying to do a gratitude practice, things like that. And then the 10th B is to blast these bugs. So again, that's the one that everyone thinks of. And I put it last for a reason, because we have to do all of these other things. They are equally as important. And so my favorite bug blasters are Cryptolepis, Japanese knotweed, cat's claw, sweet Annie, and Petunia. And
Wow.
that's it. That is my 10B approach. I know it's very long.
It's awesome though, I think. And you hit it on the head when you said, like, you kept repeating a lot of the same herbals that you use, which I think made me feel like, okay, this is manageable for someone. It's not like you're throwing 100 supplements at them.
Right. I think just doing the G3M, Japanese knotweed, Chinese skullcap, ashwagandha, Cryptolepis, sweet Annie, cat's claw, just those will go a really, really long way. And I mean, obviously you have to be, you need your D between like 70 and 90 nanograms per deciliter. You need to have adequate EPA, DHA, right? Your inflammatory essential omega-3 fatty acids. Like there's all of that other stuff. But to me, that goes back up like in the background check.
Right, exactly. Do you do genetic testing at your practice?
I'll look at people's SNPs, and a lot of people come in and they've had it done before. They've had their 23andMe. I tend to try to cover my bases. I think that for the average person that comes to see me, I think that there are tests that are going to tell me a lot more and really change the way I'm looking at them and what I'm going to tell them to do. So like my favorite thing, and I think it's invaluable, is doing a white blood cell analysis for all of the micronutrients. It's very, very hard for me to guess what micronutrients someone is deficient in. You know what I mean? Versus if it's like, looking at SNPs and looking at methylation. Okay, well, I don't use any product that doesn't have methylfolate or methylcobalamin, right? I'm not going to use any of that other cheap stuff. So, if there's an MTHFR issue, I would say the absolute basics are covered by putting them on the amount of methylfolate and methyl B12 that I put my patients on. And that's, I know a lot of people could probably pick at what I just said, but I'm just using that as a very, very broad example. I want to know people's serine levels and their choline levels and their arginine levels and, all of these other things that are really going to change my approach, because I wouldn't just put everyone on those things. Whereas like almost every patient is going to end up going on a high quality activated multivitamin that has therapeutic doses of all of the B's in there, just for example.
Which is probably something everybody should be on anyway, quite honestly.
Yeah. And then, I would rather see, because I have to tell patients all the time, like, okay, you can't have garlic, you can't have broccoli, you can't have lettuce. And it's like, who would ever think to tell a patient not to eat those foods?
I know.
But if they're making IgAs and IgG antibodies to those foods now become their poison. So it's not as easy as just saying, don't eat sugar, don't eat dairy, don't eat gluten, right? Don't eat processed food, because what if they're reacting to foods that are really healthy for you?
Exactly. This is all fascinating to me, for sure. We're going to learn more. We're going to take a quick break. You're listening to the Dr. Diane Show. When we come back, we'll be talking more about natural treatment for Lyme disease with Dr. Myriah Hinchey. Stay tuned. We'll be right back. We're back on the Dr. Diane Show with me, Dr. Diane Hayden. If you're looking to reach out to me, you can find me at www.drdianehayden.com. I'm talking today with Dr. Myriah Hinchey. She's a naturopathic physician who specializes in the treatment of Lyme disease here in Connecticut, and you can find more about her at www.taovitality.com. That's TAOVITALITY.com. So we've been talking about a ton of amazing stuff. You just gave us your 10B approach, which I think was fantastic, about how you basically will treat Lyme and help people to heal from this disease and all the complications that come with it. One thing I wanted to just make sure we talk about is, I remember you and I were speaking and you said something like October is one of the two big months for tick-borne disease transmission, which kind of like made me stop and think, because I think everybody feels like the only time they have to worry about ticks is in the spring and the summer.
Mhm.
So, so why is October such a big month for this?
Well, so my understanding, first of all, is that it has to do with the life cycle of the tick, which I don't even want to get into, even if you
Right.
want me to.
No, that's another pot. That's another show
Right.
for sure.
So, but the bigger reason is that like ticks don't like hot, dry heat. And so ticks don't like being out in the sun. And so when it starts to cool down, it makes the perfect temperature for the ticks. Also, the biggest thing is when the leaves start falling out of the trees. So the leaves covering the grass and like the moisture that gets on them, that is like that leaf litter is their favorite habitat. And then you have all of the mice coming out and the squirrels and the chipmunks like collecting all of their nuts for the winter and all of that. And it's these rodents, that are dropping off all of these ticks all over your yard and your walkway and your patio and, all of these places where you're like, oh, well, I didn't go in the woods. Like, why would I have a tick?
Right.
And, people have long clothes on and, they're like, oh, like, they don't even think, like you just said, that Lyme is even going to be, or that ticks are even going to be an issue at this time of year.
Yeah. Also, I think people are doing more yard work. I mean, they're
Right.
out in the yard, like all these leaves that you're talking about, they're all down now. If you don't have a landscaping company come in, you do it yourself. You're out there raking, you're bagging, all that. And again, not even thinking about, constantly working with this. And now when you say that, it makes absolute perfect sense that, yeah, you don't have to be out in the woods to have this happen. These critters are all coming around, your yard and stuff. And the ticks also like this habitat more than they like hot weather. So it's kind of gives more of um, a better place for them to accumulate and grow and all of that. So it totally makes sense. So what do you do? I guess some steps to preventing tick bites, and then what do you do if you have been bitten?
Sure. Oh, okay. Well, to prevent the tick bites, I like cedar oil. I like various essential oils. I also like to have my yard sprayed, and we pretty much spray, I'm going to say like 9 to 10 months out of the year, believe it or not. And we use a derivative from chrysanthemum. And we alternate that with organic cedar oil. But, beyond that, doing tick checks. So, if you can catch the tick when it's crawling on you, as opposed to once it's already embedded itself into you, obviously that makes a big difference. I was just sent a tick mitt. So there's a company that makes the tick mitt. I don't know if you've seen it yet,
No.
but it's awesome. And it looks like a little, well, it's a fluorescent green, how fitting, mitten that you put on, and you can, rub it over yourself, rub it over your child, rub it over your pets. And it just, helps to basically, if there is a, kind of like a free crawling tick on there, it just, the type of material it is helps to basically pull it off. And then you're going to see it on this very light, bright green background. So doing that, doing tick checks, and then if you do get bit, send your tick out. I like to send it to tickreport.com. That's where I tell all of my patients to send their ticks to. They are very reliable from what I have seen. They've caught things that other companies have missed. And I say that it's a long story, but I'll make it very, very quick. So I had a patient whose tick came back clean, and then she got an EM rash right there at the site where the tick was 2 weeks later. An EM rash is diagnostic of Lyme disease, and it's not like it was somewhere else on her body. It was right where the tick bite was. So
Wow.
she fought to get her tick back from the company that she had sent it to tickreport.com. They tested it 4 times because they couldn't believe that they were getting a positive test when they knew full well that the tick was said to be negative. So long story short, I already trusted them. It's who I've been using for years. but that just kind of solidified that for me. And pay for the $200 panel. It's the best $200 you can spend. They test for pretty much everything that is testable, including the Powassan virus. So you're just better off knowing what you have the potential to be dealing with, right? Hopefully the tick comes back clean. You don't have to worry about anything, but at least you know what that tick had. Now, does it mean that it gave it to you? Not necessarily, but ticks do not need to be attached for 24 or more hours to transmit these diseases. If you were unlucky enough to get bit by a tick that was already partially fed from, let's say, a mouse, and so now the spirochetes have already mobilized to from the hindgut to the salivary glands in that tick, and that tick comes along and attaches to you, and as it's putting its lovely anesthetizing agents and chemicals that actually weaken. Did you know this? Sorry, I'm going to go down a rabbit hole. So ticks release chemicals that actually imbalance our immune system from the get-go and make it easier for these organisms to enter the body. So the tick saliva contains chemokines that decrease interleukin 8, interleukin 12 in the body. And
Wow.
when that happens, it actually puts you into more of that like airplane cytokine bomb state. And then that weakens your immune system, and it actually gives these infections kind of like a helping hand to infect you. So
Wow.
anyways, I just think that's fascinating. It's something that when I learned it, I was like, you've got to be kidding me.
That is crazy. We have a couple minutes before we have to finish. I want to make sure we talk about your conference. That's okay.
Oh, yeah.
So lymebites.com is where we can learn more about it. And just quickly, the conference is for practitioners and lay people, correct?
It is for both. Yep.
Okay.
Yep.
Yeah,
so it is the 10th and 11th at the Mystic Hilton in Mystic, Connecticut. And we have 16 Lyme literate experts. Actually, I shouldn't even say Lyme literate, Lyme experts who are teaching everything from prevention, proper diagnosis, integrative treatment, natural treatment. We're looking at how a lot of tick-borne diseases masquerade as other neurological diseases, their implications in PANS and PANDAS, autism spectrum disorder, psychiatric conditions, dementia, Alzheimer's, all of that. So, you know, whether someone is brand new to Lyme literacy or whether someone has been treating Lyme disease for decades, you know, everyone is coming and sharing the most up-to-date information. And we're trying to present it in a way so that you can take it back to the office on Monday and really implicate it into your practice. And then, you know, for lay people, you know, even though it is definitely, you know, science heavy, it's still presented in a way that is easy to understand for everyone. And then we have, you know, our vendors are all industry experts. We have about 23 vendors at this point. So we have everything from hyperbaric oxygen and far infrared saunas that can be demoed to, you know, the top reliable Lyme and tick-borne disease testing companies to various nutraceutical companies.
Awesome. It's going to be so awesome. And people can register at lymebites.com. That's lymebytes.com. And Dr. Myriah, I want to thank you for all your awesome information today. It was phenomenal. As always, a great show. Thank you so much. And I want to thank all of you for tuning into the Dr. Diane Show. Please join me the first and third Thursdays at 11 Eastern, 8 a.m. Pacific. Next time, we'll be discussing more about the power of thoughts and beliefs and the impact they have on your life. Have a great week, and I'll see you back here next time. Thank you for tuning into the Dr. Diane Show, revolutionary expansion of mind, body, and soul with me, Dr. Diane Hayden. Tune in every Thursday at 8 a.m. Pacific, 11 a.m. Eastern on transformationtalkradio.com. Center your thoughts on what you want and shut the door on every suggestion of fear, worry, or lack from your own consciousness or the consciousness around you. Once you master that, everything is possible. To learn more about me, Dr. Diane, and receive a free digital subscription of my magazine, visit naturalnutmeg.com.